Pneumothorax. So it's also called as collapsed lung or disambiguation. Actually, it is an abnormal collection of air in the pleural space between lung and the chest wall. Symptoms suddenly start: sudden onset of sharp one-sided chest pain, shortness of breath. A one-way valve is formed by an area of damaged tissue, and the amount of air in the space and the between the chest wall and the lungs increases, and is also called as tension pneumothorax, causing a worsening oxygen shortage and a low BP. And it is often, that's why it is often called as collapsed lung. And coming to the pneumothorax, it is divided into primary and secondary pneumothorax. So in primary, spontaneous pneumothorax is one that occurs without an apparent cause and in the absence of lung disease. And smoking is the risk factor, often occurs in young adults. And whereas secondary spontaneous pneumothorax, it occurs in the presence of existing lung disease, and such as chronic obstructive pulmonary disease, asthma, TB, etc. And a patient may suffer hypoxemia and cyanosis and hypercapnia. Hypercapnia is accumulation of carbon dioxide in the blood. And coming to the diagnosis of pneumothorax: chest x-ray, CT scan, ultrasound, etc. And so in spontaneous pneumothorax, air may be removed with a syringe or a chest tube connected to a one-way valve system. If the tube drainage is unsuccessful or if it fails, then surgery may be required. And surgical treatment is pleurodesis, that is a layer of pleura they are induced to stick together, or pleurectomy, that is removal of the pleural membranes. And one more thing, what is a traumatic pneumothorax? Traumatic pneumothorax will be due to physical trauma to the chest, that is rib fractures, injury or stab wound or gunshot wound, etc., which this allows air to enter the pleural space. And hemothorax will be blood in the pleural space.